Welcome back to our med school. Today I'll be discussing about the prophylactic treatment of migraine. It's a practical how to use the medicines, what are the doses, what are the contraindications. These are things which I'm going to discuss. Migraine is the second leading cause of global disability. Second leading cause of global disability. That is one point that you should keep in mind. So we'll be looking into the guidelines, how the management is usually done, followed by each drug. The usual prophylactic medications are 1. Beta blocker, 2. Antidepressants, 3. Anti-seizure medications, 4. Calcineurin blockers. In special situations, we may go for calcitonin gene-related peptide-based therapy. The recommended criteria for starting treatment. So, for prevention should be offered when there is 6 or more attacks, even without any disability, or 4 or more attacks with some disability, or more than 2 with a severe disability, you should suggest or offer prophylaxis. This can be considered even with the 2 with a severe disabling symptoms. So in short, we can say that prophylaxis is offered when the number is more or disabling symptoms are there. You will think about so minimum 3 or more severe symptoms. You should definitely be offered even for 2 disabling symptoms, or 2 attacks of disabling symptoms you can think about or you can consider. So preventive therapy aims to reduce the attack frequency, severity, and disability. That is the aim of prophylaxis. So what are the indications of prophylaxis? I will repeat once more. Start prophylaxis if any of the following 4 migraine attacks per month or severe disability despite acute treatment. Or consider if it is more than 2 severe attacks. You can think about starting or you can offer the treatment. So in addition to this, acute treatment like triptans are contraindicated. For the patient has got the medication overuse headache and the patient prefers to have prophylaxis treatment, we can recommend. So preventive treatment is recommended when attacks are frequent or disabling. That is the single liner indications for treatment. Now we think about what are the first line treatment. Usually we start with the evidence-based treatment. One is beta blocker. So it's a commonly used medication. So which beta blocker usually we will give? It's usually the propranolol or metoprolol is usually given. What is the dosage? Propranolol start with 20 milligrams and up to 160 milligram, 20 to 160 milligram. That is the usual preferred drug. Or you can give metoprolol 50 to 200 milligram per day. So let us look into what are the advantages of beta blocker. There is a good evidence for beta blocker. It is useful when there is anxiety, tremor, and other symptoms are there. But what are the disadvantages? It produces fatigue, bradycardia, should not be used for bronchospasm. And any heart block, it should not be given. So these are the contraindications. Second group of drug is the antiepileptics. The 2 antiepileptics that we routinely use are one is the topiramate and second is the valproate. These are the 2 drugs which are having evidence-based. So let us look into the mechanism of action of topiramate. So it has got multiple mechanisms. So it will be antagonism of the AMPA and kainate receptors It has got some effect on the carbonic anhydrase inhibition, enhancement of GABA activity, and inhibition of the voltage-gated sodium channels. So there are multiple mechanisms of action. The details will be discussed along with the antiepileptics. So what is the mechanism of action of sodium valproate? Again, sodium valproate has got multiple sites of action. Mainly, it inhibits the GABA transaminase. So that produces increase in the concentration of GABA in the brain. In addition, it has got a presynaptic inhibition of the presynaptic discharges and postsynaptic discharges. The details will not be covered here. So, in short, we can say that we have got two drugs. One is a topiramate, second is a sodium valproate. Usually, topiramate is used routinely. The reasons, the side, and also let us look into the major side effects of topiramate. Common side effects are: one is paresthesia. This can produce cognitive problems, fatigue, weight loss. It can be used beneficially in obese patients. Can produce dizziness, nausea, perversion of the taste. Serious effects as it is an carbonic anhydrase inhibitor can produce metabolic acidosis, depression, remember nephrolithiasis. That is so somebody with a renal stone, you should not give. Glaucoma is another very important contraindication. Somebody has got a glaucoma, you should not. Two major contraindications, remember. And can develop suicidal behavior also. So there are many side effects for topiramate. Then what is the dosage topiramate? Usually start with small dosage, 25 milligram to 100 milligram. Start with 25 milligram and increase gradually to 100 milligrams per day. What about sodium valproate? Again, to start with 250 milligram. A small dose start and step up to around 1000 milligrams per day. So that is the dosage of these antiepileptics. That is topiramate, start 25 milligrams, valproate 250 to 1000 milligrams per day. So what are the advantages of these drugs? There is a good evidence for chronic migraine. That's what a very good. It is efficacious. But again, remember, topiramate can produce cognitive slowing, word finding difficulty, and valproate can produce weight gain. In polycystic ovary, it cannot be given, and those who are planning for pregnancy, it cannot be given. So remember, sodium valproate is absolutely contraindicated. Those with in pregnancy. Topiramate and valproate are effective preventive therapies. But again, remember this picture, that is, this can neural tube defects, one of the dreaded complications of sodium valproate, and so it should not be given to those who are planning pregnancy. Hope it is clear. So now we go to the third group, very commonly used, the amitriptyline or antidepressants. So antidepressants are routinely given, but again remember, this is not given for the depression. The dosage is not as high as that for a patient with a depression. The common drug is amitriptyline. So commonly we give amitriptyline. Can start with a small dose, 10 milligram, and can gradually step it up. So it is not, and as I have already mentioned, it is not the dose that is required for depression. Usually start with the 10 milligram, step up to around 75 milligrams, and give at night. What are the advantages? It is those with insomnia, it is a good drug. And again, with mild depression, again, it is a useful drug. So, what are the disadvantages? It produces sedation, it produces a dry mouth, contraindications, especially in the elderly. We can cardiac problems. Second is patient with the prostatic problems. It has got an anticholinergic effect. So this can produce behavioral problems also. So that you should be careful regarding the side effects. I will repeat. This contraindicated in cardiac disease, and in elderly should be careful. And it can produce sedation and dry mouth. So we have covered the three major drugs: the beta blockers, anticonvulsants, and antidepressants. Now, the next group of drug is the calcium channel blocker. Among the calcium channel blocker, the drug which is given is the flunarizine. So, flunarizine is given start with 5 to 10 milligrams per day. It is has got a very simple dosage, and the major side effect is it can produce weight gain, and also this may induce depression. So now we look into the drugs as a chart. The drugs are, one is propranolol. It is cheap, effective, but it can produce fatigue. It's contraindicated in patients with obstructive airway disease. Topiramate, it produces weight loss. That's an advantage. Cognitive issue is a major side effect. Renal nephrolithiasis, glaucoma. Sodium valproate, remember, teratogenic. It is a very strong efficacy. Amitriptyline, the sleep benefit, but it produces sedation, and in the elderly patients with glaucoma, BPH, it can produce problems. So now we think about how to start the treatment practically. So we have said about the drugs. So start with the stepwise approach. That is what the next session I'll be discussing, how to initiate treatment in patients with migraine. Stay tuned. Thank you.